Hello, my name is Margaret Evans Burton, and I'm a family nurse practitioner student, and I will be presenting a patient today. I have a 37-year-old Caucasian female who is here today with a chief complaint of right flank pain and right lower quadrant abdominal pain that has gotten worse over the past 4 to 5 hours. Patient states the pain is an 8 to 9 out of 10 and comes in waves. She also has complaints of nausea. She has never had these symptoms previously. She has no history of chills, fever, night sweats, weight loss, or weight gain. Patient has no history of anorexia, diarrhea, or constipation. She does admit to nausea, but no vomiting. Patient denies hematuria, nocturia, frequency, and incontinence. She admits to dysuria upon further questioning. Patient has no history of sexually transmitted infections. Patient denies history of muscle strain or injury. Patient has no history of arthritis and joint stiffness. Patient denies rashes, lesions, skin cancers, or skin diseases. Patient has a history of 4 vaginal deliveries, and she is currently using the birth control pill, Yaz. Her last menstrual period was April 5th, 2013. She is married, denies smoking and alcohol consumption. Patient denies allergies. She is currently taking Yaz for birth control, and that is her only medication. Her vital signs are temperature 99, respirations 22, pulse 101, blood pressure 140/78. Patient is a well-developed, slightly overweight female in obvious pain. She is alert oriented ×3 with clear speech. Her abdomen is flat, soft, non-tender, non-distended, no guarding or rebound pain noted. Bowel sounds are active in all quadrants, no bruise or masses. Back is symmetrical, no lordosis or kyphosis noted. Tenderness on palpation at right flank, no masses noted. Patient has nausea but denies vomiting. Patient admits to dysuria. A urinalysis was performed and is positive for a large number of crystals, moderate amount of microscopic red blood cells, moderate leukocytes, and is positive for nitrates. Her urine was sent for culture. Urine pregnancy test was negative. A pelvic ultrasound showed hydronephrosis of the right kidney. Her bladder appears normal. Ovaries and uterus also appear normal. Her CBC was within normal limits. The differential diagnoses I have for this patient are appendicitis, but her CBC was within normal limits. There was no rebound pain or tenderness noted, and there was no enlargement of the appendix noted upon pelvic ultrasound. Next one, muscle strain. The ultrasound shows hydronephrosis of the right kidney and no history of activity that would cause muscle strain. The next one is ectopic pregnancy, but urine pregnancy test negative, and ovaries and uterus normal on ultrasound. The primary diagnosis I have for this patient is kidney stones, and I came to this diagnosis by physical exam, urinalysis, and pelvic ultrasound. I would treat this patient with Motrin 600 mg PO every 8 hours. If her pain becomes severe, I would give her Lortab 5 mg PO every 4 hours. And I would also give her Flomax 0.4 mg PO every day for 3 days. Then I would have the patient come back in to reevaluate. I would also give this patient Zofran 8 mg ODT for her nausea. I would instruct the patient to increase her PO fluids. I would also instruct the patient to return for fever or worsening pain. Thank you for listening.